Do all Americans want Medicare for all?
Most do. Recognition that Americans need universal health care, as the rest of the world is doing, has taken some time to catch on. Now even most American doctors support Medicare for all. The idea has been percolating in the American conscience for decades. In 1949, President Harry Truman proposed a public health care law. Ross Perot, when he ran for president in 1992, said all we have to do is look at what the rest of the world is doing and copy them. Even President Trump, in his book, The America We Deserve, stated his admiration for this approach. And in 2015, he said, we could have a great system in this country. But just recently, he changed his tune and tweeted, this would be a curse for the United States. But Medicare is popular with 77% of Americans, just below Social Security at 83%. They consider it to be very important in American life. Nearly 2/3, nearly 2 out of 3 Americans have a positive reaction when they hear the phrase Medicare for all. And in fact, 1 out of 6 Americans now get Medicare. In reality, we're 2/3 of the way toward having a single-payer system. 2/3, well, virtually 64.3% of all health spending comes from the federal government, either in the form of Medicare, Medicaid, and the Veterans Administration. Why then, as we as a country spend more than double per capita on average of other industrial nations, yet we rank only 28th in the quality of health care? We have shorter life expectancies and higher incidences of chronic diseases than in comparable developed countries. We alone among the industrialized nations of the world do not have universal health care.
What's standing in the way?
Or another question to ask is, why do Republicans want to put the brakes on American health care and separate government from health care? Here in their own words is what they say. Americans with pre-existing conditions are crooks and grifters. Sorry, Jimmy Kimmel. Your sad story doesn't obligate me or anybody else to pay for somebody else's health care. Medicaid is giving money to the dole. Americans have choices, and so maybe rather than getting that new iPhone that they just love, maybe they should invest in their own health care. Just repeal Obamacare now. They'll be desperate for whatever we give them. As I said from the beginning, let Obamacare implode, then deal.
Why do Republicans think this way?
Many people grow up believing that when other people get into money troubles, they're spendthrifts. Even with sickness, particularly lifestyle illnesses, many people blame the victim for their choices. In other words, poor people are poor because they made bad choices. On the other hand, these same people may blame themselves or view themselves as victims or treated unfairly when bad things happen to them, whether health or economic. Conservative think tanks have come up with a new list of freedoms. You're free to be poor, you're free to be politically powerless, and free to be uncared for. It's all a matter of the decisions you freely make in life, and society has no business interfering with your free will. In other words, freedom from health care. To be sure, not all Republicans have this attitude. Almost half, as do almost 3/4 of Democrats, and 62% of independents view Medicaid as an insurance program similar to others that help people pay for health care. We can see this in the actions of some Republican governors and senators.
What's the argument those opposed to Medicare for all are using to scare everyone?
It's money, it's the economy, and expense. No politician wants to raise taxes. So the question then becomes, how do we fix the system? Gone is the 15 to 30% of every healthcare dollar that profiteering insurance companies take for their administrative and advertising costs, exorbitant profits, executive pay, paperwork, incompatible computer systems, million-dollar bonuses, delays that come about by doctors and hospitals not being able to seamlessly communicate with one another. Doctors are spending an enormous amount of time arguing with insurers. The nation saves money because Medicare's overhead is only 3%, not 15 to 30%. It eliminates duplicative insurance coverage, simplifying the system. It'll also cut out the complexity and stress of getting the care you need. Just go to any private doctor you choose, show your Medicare card, and bingo, you're in. No more copays, deductibles, filling out forms, or endless wrangling with corporate insurance bureaucrats.
Why will this work?
First, no other developed country in the world has for-profit health insurance, which means no multi-million-dollar salaries for health insurance executives, no millions of employees putting obstacles in the way of your getting your insurance bills paid. Second, governments negotiate lower rates directly with drug companies and healthcare providers, the way it's done in other nations. This way, the providers are not incentivized to find ways to serve only the healthiest people and not those with the greatest needs. In Canada, the overhead is just 1%. This comes from system savings both in hard dollars and the ability to predict what costs will be. Without major changes in how we deliver health care, what we spend on health care is going to rise with an aging population. Our system is not prepared to take care of our elderly, nor the millions of people who will not be able to get employer-paid health insurance due to robotization, automation, and self-driving cars. Remember, American spending on health care per person is more than twice the average in the world's 35 most advanced countries. Yet our Americans are sicker, our lives are shorter, and we have more chronic diseases. Let's do the math. If you divide the $3 trillion the United States now spends on health care by our 323 million people, it comes out to just over $9,000 per person, at least double what other countries spend on their citizens. The United States is also the only country in the Organization for Economic Development without universal health care. And we have the largest share of unmet health care needs due to the cost of medical care. But if we really cut costs to the average that other developed nations spend on health care, we would be spending $3,661, and with a population of 323 million, we might be able to cover all our health care for about $1.2 trillion annually, well under half of what we're spending now. So can we afford it? The answer is yes. Existing insurance companies don't need to go out of business. They can shift their policies to cover doctors with boutique practices who choose not to accept Medicare's payments, and cover health-related services not normally covered by health insurance, like elective plastic surgery. Many people working for insurance companies can shift to the companies that administer Medicare now, or existing insurance companies can become lower-cost contractors. With Medicare for All, families can expect to see the cost of health care coverage decrease by 1/2 or more. Senator Sanders' bill will cut the health care costs paid by typical working families from some $6,200 a year to $466 a year. Medicare pays existing health care providers adequately. Everyone will come out ahead because total health care costs would be lower and outcomes far better.
Where will the funding come from?
Ideally, it would be financed the same way Medicare and Social Security are financed now, through the payroll tax. Wealthy Americans will pay a higher payroll tax and contribute more than lower-income people. We may need to raise the payroll tax from the existing 7.65% by up to 4.7% and still be paying less. increase the tax on stock transactions from 0.25% to 1%, tax marijuana, and maintain current state and federal government funding, which includes payroll taxes, taxes on Social Security, and that's about $2 trillion.
Who's losing out?
45,000 people die each year for lack of health insurance. Currently, medical care is so expensive for the typical American that many people have put off seeing a doctor until their health is seriously deteriorated. A recent study found that 16 million Americans can't afford to treat a broken arm costing just $500. In fact, 44% of adult Americans claim they could not come up with $400 in an emergency without turning to credit cards, family and friends, or selling off possessions. With Medicare for All, people would not be turned away. When former Vice President Biden's son was dying of brain cancer, the Vice President and his wife nearly had to sell their home to pay for their son's medical bills. Every year, countless numbers of American families face difficulties of this kind. Better than 1 out of every 2 Americans, 55%, worry they will not get the health care they need.
What will Americans have with Medicare for All?
Everyone is covered automatically at birth. All residents are covered, regardless of immigration status. Covered are medically necessary services, including primary and preventive care, mental health care, reproductive care, vision and dental care, long-term care, and prescription drugs. Full choice of any participating doctor or hospital. Providers may not dual practice within and outside the Medicare system. No premiums, deductibles, or co-pays for medical services. Balanced billing prohibited, or co-pays for most drugs.
Is now the time for Medicare for All?
Yes. Something that didn't capture much news attention was an amendment proposed by a Republican, Senator Steve Daines of Montana, to create a national improved Medicare for All. Whether this was a legislative ploy doesn't matter. That a Republican senator from a conservative state could do this signals a tidal change in American values. Healthcare, its cost, and having it when you need it is a worry shared by most Americans. The Buddha said it succinctly, without health, life is not life. Without good health, and the assurance that if you get sick or hurt, you can take care of yourself, your ability to earn a living, and enjoy life. Short of full Medicare for all, several amendments now before Congress would allow any American to buy into Medicare, just as they would buy any insurance policy. This would be a worthwhile next step in securing America's health future. Senator Chris Murphy of Connecticut calls this Medicare buy-in. Now is the time for Medicare for all. As Senator Sanders said of those opposing Medicare for all, they are on the wrong side of history.